GLP-1 should not be the last resource for anybody. If you feel that it's out of your hands and it feels like a full-time job, you should start with a GLP-1. If you're somewhere in between, lifting weights is always the best answer. But what I'm seeing now with GLP-1, we are reaching metabolic health that wasn't possible before.
Hi, I'm Dr. Vonda Wright, and this is Hot for Your Health. Join us for conversations on the bleeding edge of science, health, and culture as we bring you tech innovators, thought leaders, and the movers and shakers who are transforming science fiction into your new health reality. Dr. Rocío Salas-Whalen, I'm so glad to have you on this podcast, not only because you are a triple board certified physician with offices in Manhattan, serving thousands of smart, savvy people, but over the last few years, we've become friends. So I'm so happy to have you here with me today.
Thank you so much for having me today. I enjoy our conversations a lot.
Absolutely. Well, you were just a superstar at my Women's Health Conversations conference that we had in Orlando. And I think your heart and your soul really came out as you were talking about your book, Weightless, as you were talking about your patients. And so before we get started really digging deep into Weightless and why you wrote it, tell me, what makes you show up at work every day, besides the fact you're a physician and you have a business, but why? What is your heart and soul? Why do you come to work?
Because I see and I know the possibility in my patients of reaching optimal health. Mm-hmm. I see the possibility in them. I know it can be done. They just need to be guided the right way.
Do you find people come to you sometimes with the world's best intentions, but sometimes lost? How do people arrive to you when they come?
For many of my patients, I'm their last stop. I'm like the last opportunity, the last chance that they're giving a doctor, right? Because I see many patients with obesity, overweight, that they've struggled with their weight through their life, and they've been approached or seen by doctors that didn't believe them, just kept giving the same recommendations, didn't spend enough time with them to build trust in a relationship, right? So many patients, I would say, if not the majority, come skeptical, right? Like let's see if it's something different. And I have to say that that's one of the other things that make me get up every day, is to show them that there's good doctors, right? That there's doctors that still believe in that idea of having a relationship with the patient. If you build trust, right? If you respect the vulnerability when they come to you and they tell you their deepest fears and traumas and shame and guilt. And when you respect that conversation, everything changes. The relationship becomes really bi-directional.
Well, you talk a lot about, almost every time I've heard you speak, about the emotional and psychological load women carry around in addition to just the poundage. Is that what you're talking about? That the chronic stress and emotional burden of being metabolically unhealthy is more than just belly fat?
It consumes their life for many patients. And for many of them, it consumes their life for decades, right? I can see in my patients, and some patients, it's a 24/7, every plate in front of them. It triggers something, right? It triggers memories, it triggers shame, it triggers guilt, it triggers anxiety. What do I have to do next to burn it up so I don't see the pounds gaining? How is this going to affect in my journey? Is it setting me back? Like, what do I need to do to compensate what I'm going? It's a constant struggle. And I see patients struggle with that since their teenage years, since childhood, and they could be 40, 50, 60, and they're still struggling, right? So it's a lot of burden, not just the physical weight, but the emotional weight.
Rocío, frankly, it sounds exhausting. And I wonder if this phenomenon that you see time and time again is why you entitled your book Weightless.
Yeah. So it's a metaphor of what I see my patient's journey be, is when they come in bringing me excess weight as their problem. Through their journey with me, on medication, I see them drop the physical weight, but then mentally, psychologically, emotionally, they become lighter and lighter and lighter until they become weightless, right? They drop the guilt, they drop the shame, and then they drop the physical weight. So it's what I want for my patients to be, right? That's the experience I want my patients to have. And I have this unique perspective from seeing patients with obesity every day, 5 days a week for the last whatever years amount. It's something that I can provide to more people through a book than me seeing them as a patient, right?
Right, there's only so much of you in 8 hours in a day, right? So it democratizes the information. So many people feel like weight loss is that number that comes up on a scale. You know, you're digitally now, it's blinking, 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 and what's it going to stop on? But the number on the scale actually, I don't want to call it a minor biomarker, but it's only one biomarker of metabolic health. Do you want to, as we get into what your method is, because your heart is so evident from the way you describe the burden that these women and men carry around, but as we get into your method, it's not just stepping on a scale. What are the other biomarkers that you as a whole person doctor look into?
And I think that's one of the things that when you educate your patient with, you explain your patient, it also removes a lot of pressure in a certain number and fitting in certain size, right? Because what we try to achieve, what I try to achieve is not weight loss per se, is body recomposition, right? What is it in your body that either increases your risk of sickness or decreases your risk of disease, right? And those going to be three components that we cannot see to the simple eye, right? That's why we need to look further and internally, what are your numbers? And the three markers that matter for health is your skeletal muscle mass, right? That's what you can build in regards to muscle. The other important marker is your percentage body fat. And percentage body fat means what percentage of your total body weight is fat. And then your visceral fat, which is your internal fat that surrounds your internal organs. That's like the bad fat, that's a toxic, active fat that is producing cytokines, pro-inflammatory chemicals. So having low muscle mass is pro-inflammatory in your body because we make in our muscle called myokines that are anti-inflammatory. And then having high visceral fat is also pro-inflammatory. So those are the numbers that we need to change as we approach weight loss.
Well, and the simple scale we have in our homes without the more body composition scales, I think when I do body composition measurement on my patients who have never done it before, the numbers are really shocking sometimes because you don't have a sense for how much muscle you have. I mean, I like people to have at least 40, usually 50% muscle, but you don't know if you have that, or people are repeatedly shocked at what percentage of their total body is fat.
Yes.
Right? Because you can't perceive that.
And that's why one step further, when we're looking at the progress, we cannot count as progress just dropping pounds in the scale, right? Is what is it that you're losing and what is it that you're gaining? So, and also showing this to patients, it's like a switch. It becomes health and not aesthetic. Yes. Right? Because many patients come with that idea of a physical weight loss, wanting to be a number 8, 6 in their pounds, how they were in their 40s and their 30s. But when you show them their health and their markers, it takes a completely different pattern and it helps them also to focus on those things. So it's really interesting, and I love it when patients switch that idea at the beginning. How much did I lose to how much muscle did I gain?
Yeah. And I see you teaching that way on Instagram. You will, if you guys are not following Dr. Rocío Salas-Whalen, you need to go do that on Instagram, because what you'll do is you'll bring up actual body composition tracking, because you have the same machine in your office. So you're able to track over time people's progress. And what you are very specific to show is when this recomposition is done correctly, you'll track that there will be no loss in muscle, or if there is, just a titch. At the same time, a dramatic decline in body fat versus people who may have not followed your instructions. This was just one the other day. They lost 8 pounds, they lost muscle, they course corrected, they stayed. So walk us through how you use these 3 measurements on a typical patient like you do on Instagram every day.
So I always do a body composition at their first visit, and then every single visit I repeat a body composition, right? I mean, if somebody has a body composition machine at home, they should not do it more than 2 or 3 times every 2 to 3 weeks, because they're internal changes and those take time, right? So I do one every 8 to 12 weeks, every time I see the patient for a follow-up. And it's really important to show them what they're doing at home. How does it reflect in their body composition? Because many patients, especially on the first visit, they don't get it, the importance of the protein and the strength training, but then they come in their follow-up and they lost 8 pounds, but forward muscle, they get it, right? They're like, oh, okay, I have to change. So every visit, they start focusing more on muscle mass. And once you get a patient, I don't want to say hooked, but interested in muscle, it's like everything falls into place, right? Because I know when somebody comes to me and I see muscle gain and I see percentage body fat drop without asking them, I know they're eating enough amount of protein that gain muscle, but still losing the body fat. So that tells me it's not just enough, but it's also the right type of protein, right? And then if they're gain muscle, most likely they're lifting weights. So that tells me already what they're doing at home without me needing to ask the patient, right? And when they see those results, patients feel a very high accomplishment because it's hard work.
It's hard, but it's so motivating because they don't want to disappoint their own data. They don't want to disappoint you, but it's now internalized. So you summarize your method that we're describing as a GPS. What is the body recomposition GPS?
And I always like to make it as easy as I can for my patients, because there's going to be many complicated things, but I feel like the more easy, the more adherence that they're going to have, right? So GPS, as simple as it is like your navigation system of this journey that you're embarking with a GLP-1 or not for weight loss. Is G is for GLP-1, P is for protein, and S is for strength training. So if you remember those 3 things, that's what you need to do, and that's what's going to take you to the road of success. And it's really interesting because it's not just the numbers, it's how patients feel.
Yeah.
Once a patient feels strong and they're like, oh, I could do this, I could lift this, it's like there's no turning back. Once you touch the strength and how you feel lean and how your body is changing in a different, like tighter, leaner, but stronger. It's just not a look, it's a feeling.
So let's unpack each one of those things because each thing is so important. And you are a national expert on the appropriate use of GLP-1 therapies. I mean, I think people would have to be living under a rock not to have heard of the explosion of GLP-1s, not only the early drugs, but now there's secondary and tertiary and brand new ones.
Yeah.
Go all the way back on what is the GLP-1 peptide? What does it primarily do? And what are the proper indications, according to the way you practice medicine, the standard for thinking about prescribing one?
Yeah. So GLP-1 stands for glucagon-like peptide. It's a hormone that we humans make in our gut. And this hormone, its main action that was discovered for was an effect in the pancreas. It's glucose responsive, meaning that if your glucose goes up, it's secreted in the small intestine, and it stimulates the beta cells in the pancreas to make more insulin. So it's a glucose response insulin effect. If your glucose is below the threshold of normal, we don't see such a strong response in the pancreas. Reason that they don't cause hypoglycemia. Your sugar actually has to be high to have an effect on the pancreas, right? So that's the main function, and that was the first indication back in 2005 for type 2 diabetes. And then It also has receptors, and through time, it's found that we have receptors to this hormone all over our body, in our brain, in our gut, in our lungs, in our kidney, in our liver.
Mm-hmm.
And the effect for weight loss is more of a neuro gut effect. So in the gut, it stimulates the satiety hormones,
Mm-hmm.
decreases your hunger hormones. So what it looks like, or what it translates, is to small meals throughout the day, feeling physically content,
Mm-hmm.
right? But in the brain, we also have receptors, and it actually is some amount of GLP-1 is also made in the brain,
Mm-hmm.
and it's in the amygdala, in the hedonistic eating and drinking area of our brain, where it's the reward system,
Mm-hmm.
right? The dopamine release, anticipating a reward from food or
Mm-hmm.
beverages.
Mm-hmm.
This hormone, GLP-1, blocks that reward response.
Mm-hmm.
So, as to imagine as if you're somebody who associates chocolate cake with feeling pleasant and
Mm-hmm.
happy, you're on this medication, you see it, and it doesn't give you that reward response.
Mm-hmm.
That doesn't mean that you won't enjoy it when you're eating it, but then you're physically content with a small portion, and that's it. But you're not looking for the reward to
Yeah.
fill that reward system.
I've heard the very first time I became aware of this, one of my patients actually said to me, she had one of her other doctors had given her a GLP-1, and what she described to me was that she no longer had the constant buzzing food noise in her head, like she was a hunter-gatherer trying to
Hmm.
scavenge for food. And I guess I hadn't realized because I'm thankful I don't have food buzzing in my brain. In fact, I may be a little bit unimpressed with food. I view it as fuel only. I'm like, you know, so I'm like, oh, it's fuel. But she was saying the way it really helped her was shutting off that constant buzz. Is that common?
Yeah, I mean, that's just constant thinking of food, or feeling hungry, of grazing. And for many, is that anticipation of a reward of certain source, right?
Yeah.
If you're bored, if you're anxious, if you're late night eating, alcohol, right? And that's another use that's being found, that it decreases, suppresses that drive to keep drinking. So you're more moderate and more control with food and alcohol or beverages.
Well, both things can save your life. So, who is the appropriate person to consider starting on a GLP-1? We call it in medicine, listeners, we call it, what are the indications for this?
So currently, it's patients with type 2 diabetes,
Mm-hmm.
right? And patients with obesity or overweight.
Mm-hmm.
Those are the two main guidelines. From those two guidelines, there's come like secondary indications:
Yes.
sleep apnea, cardiovascular protection, renal function protection.
Mm-hmm.
But those secondary are in patients with pre-comorbidity, as type 2 diabetes
Mm-hmm.
and obesity or overweight, right? We don't have indications without diabetes or without having to lose.
You know what? I was speaking for the American Diabetic Association earlier this year about perimenopause, and in doing research for that talk, I became I don't know what the right word, like obsessed maybe, with the fact that prediabetes is in all intents and purposes in the United States diabetes, because 70 to 90% of people with prediabetes, which many people are told by their caregivers, whatever, just watch your food. I mean, just very casually, 90% will get diabetes, and it's become an obsession with me. Even though it's not in the official guidelines, is there a role for pre-diabetes where you've got a consistent blood sugar? I'm making these numbers up, but 100, 110, your hemoglobin A1C is creeping up into the mid to high fives. Is there an indication for that?
Definitely, because we know that the there's microvascular complications with very early hyperglycemia, right? So even when you're in the pre-diabetes, we know that there's already some damage in microvascular being happening with that elevated glucose,
Yeah.
right? once somebody is diagnosed with type 2 diabetes, we know that 15 to 20 years there was some hyperglycemia, hyperinsulinemia happening,
Yeah.
right? We cannot be early enough. And I'm glad the A1C is dropping every time to what was considered normal, because that micro complications that can happen very, very early on before your A1C is 6.5.
Right.
So when we say off-label, this could be one off-label, right? That the indication that I mentioned is with insurance coverage. If somebody's going to pay out of pocket, then we can get a little bit more creative, right? And being more broad. Like for me, if a patient maybe is not in the overweight category, maybe it doesn't have obesity, but it's a 24/7 trying to lose those 15, 20 pounds, and they have a diabetes and their A1C. I won't wait for them to get a BMI of 35 before I say, oh, let's do a GLP-1. If they can pay out of pocket and cost is an issue, but it's becoming more accessible, then they benefit from the medication too under the criteria of the prescriber, right? So I have more than 15 years prescribing this medication. I say I know them longer than my kids.
Oh.
I feel very comfortable with them to do off-label prescriptions safely, right, in certain cases.
Right. So that in the GPS system, that's G. Let's go now to P, protein, because you are very strong in your writing and your speaking that we must maintain muscle mass while we lose weight. So talk about protein as you do as a mediator.
And protein is not a new fad diet. I know we're hearing more about it because of the GLP-1, but you are in this business of training and weight training. I lifted weights since I'm in my 20s. Protein, and as you said, protein is part of your diet. And when I see a plate is how much protein does this have? How is it going to fuel my bones and my muscle? That's all I care about, right?
Yep.
We've known that protein is a very important macronutrient, right? But GLP-1 has shone light even more on how important it is for muscle preservation and muscle building. And when we talk about protein, we talk about complete proteins in our diet. And there's only two true complete proteins that has the 20 amino acids that are required for muscle protein synthesis. And that's animal protein and whey protein, right? So those are the two. And I see this a lot. Patients that are on plant-based protein.
Yeah.
It's very hard to gain muscle, they lose muscle. And not only that, osteoporosis.
Yes.
I see a lot of osteoporosis in my vegetarian, vegan, plant-based patients because they're losing muscle, they're losing bone. If they're losing bone, they're losing muscle, right? And I see the difference once a patient switches to either whey protein, or some start consuming animal protein because they see their bone and their muscle and it starts to pick up really nice. So that's the protein that we recommend. And what I've seen over thousands of body composition in women, the good spot of amount is around 90 to 100 grams of protein a day. Not lose muscle on a GLP-1, but to gain, then we have to go to 120, 110 in the lifting. But I break it to my patients in 4 portions of 25 to 30 each. It could be shake, meal, shake, or 3 shakes, 1 meal, 3 meals, 1 shake. They can alternate depending on their day, right?
I get a lot of feedback from people when I'm preaching the gospel of complete proteins about, oh my God, I can never eat that much food. But the reality is protein can be very dense, very volume small. So I think that's a misconception that you're eating ribeyes every meal, the size of right. It can be, this morning, for instance, I had a cup of Greek yogurt that had 20 grams of protein in the size of my palm, right? It's not a lot of volume.
Yeah, it's not, and it's 6 ounces of fish. And it's how you cook it and what type it is, right? So it should be grass-fed, it should be pasture-raised, it should be wild-caught, nothing farmed, nothing grown like GMO or hormones or antibiotics. And then how you cook it matters too. It should be grilled, poached, broiled, right? Not fried, breaded. So it matters how you cook it and what the source is.
Absolutely. And it sounds like a lot of prep. I promise you, people listening, it's not that hard, actually. It's not a lot of prep. It's actually very simple cooking.
It
No.
becomes very automatic
Very,
too,
yeah.
right? Like you pick your chicken breasts and your vegetables. If you go to a restaurant, you pick your source of protein, and then
And
you're
that's
good with that.
easy.
Finish that. I always tell my patients, finish your protein first
Yeah.
before you go anything else on the plate.
That's right. So you get it in. So GPS, strength training. What is your recommended regimen for strength training?
Old schools, Arnold Schwarzenegger, Gold's Gym.
Gold's Gym.
Oh wait, yes. Lift, get those dumbbells. Go, if not, do the machines. But there's
Mm-hmm.
no other way. There's no other way. Pilates is great for balance, flexibility, stability,
Mm-hmm.
core. Yoga is also good for mindful core flexibility, which is important as we grow older.
Yep.
But to really build that muscle mass, you need to lift heavy, either at home with dumbbells or either with machines or a combination. And if you never lifted weights, don't do it alone. Get a trainer to
Mm-hmm.
watch, teach you, and then you can feel comfortable to be on your own. But I think injury will take a step back. So we need to be very smart. Weightlifting is a game of patience, discipline, right? Because
Mm-hmm.
it takes time to see results. It takes
Mm-hmm.
time, the strength to lift heavy and build muscle, and then you have the discipline of what you're eating to feed those muscles, and you need to sleep to build muscle. So
Absolutely.
really lifting weights, building muscle is one of the best choices that anybody can have or do because of what it implies to have that lifestyle. I
I.
think professionally,
Mm-hmm.
lifting weights has teach me to be disciplined, has teach me to be patient,
Mm.
right? To go, maybe sometimes I lack off and then go back on it and then restart, but not from
Mm-hmm.
the beginning. I really feel like the discipline of lifting weights can be applied beyond the gym to your life, professionally, personally.
I agree with you. The showing up for yourself. I mean, willpower. In my opinion, uh, people say, and this is probably what they say about the weight loss journey. You have to have the willpower. I think willpower exhausts immediately, and it's about the discipline and the doing the hard things. Honestly,
Yeah. And many patients think like, oh, I have to go to the gym 5 days a week. Nobody can do that. Only in my 30s, before children, early, I
right,
could do that.
right.
But now, I mean, even if I do 2 times a week, one day I do upper body, one day I do lower body. I walk in between.
Hmm.
But 2 days is great. 3 is ideal, and that's it. You don't have to go 5 days a week, 2 hours a day.
Well, and that leads to the concept I love to talk about is come on, people, we got to give ourselves some grace, right? Because do you think sometimes we beat ourselves up over not losing weight, and then once we're in a pattern, if we're not careful, we beat ourselves up about all the things that we're supposed to be doing, understanding this is a journey. How I've seen your results on Instagram, and it seems like as soon as 8 weeks, which is not a lot of time, people can see some profound changes. When do people start to notice in their own lives?
So I like for patients to lose around half a pound to a pound per week
Mm-hmm.
max, because that's telling me it's not all muscle mass.
Mm-hmm.
If you lose 2 pounds, 3 pounds, I can tell you 40%, 30% of that was probably muscle.
Mm.
When you lose muscle, you lose your burning calorie machine,
I
right?
know.
You're not going to burn fat. It's when your metabolism slows down because muscle fuels your metabolism. So half a pound to a pound is a safe bet.
Yeah.
So it's going to take that required amount of time for somebody to lose 30 pounds, 50 pounds. I've had patients lose 160 pounds is the one that has lost the most,
Yeah.
right? It was over almost 2 years. But the patient is fit, strong,
Mm-hmm.
they feel amazing. And when you take that time, those habits are more adaptable. You'll
Yeah.
keep them longer. You try to do something in 3 months. That's not the point of anything that I do. It's not a short-term goal. This is your life-term goal.
Right. Well, when you talk about, I want to go back to something you just said and give my own example of how many calories you burn when you have more muscle, right? So when I went through my perimenopause, and I always describe it as I got hit in the head with perimenopause about 47. It was really a hard time. In the couple years between that and when I started really lifting heavy again, When I first stepped on a body composition scale before I started lifting heavy again, I had lost so much muscle that my basal metabolic rate, meaning for people listening, my calories that I'm burning just sitting here, was barely 1,300, which is not much calories to play with during a day, right? And by the next time, and then I gained 8 pounds of muscle, and I can't remember the time period, but I was really doing all the things that you're talking about, lifting all the time, eating so much protein. I could see the body composition change in my body. But when I stepped on the scale again, I had gained 8 pounds of muscle. I had lost 12% body fat. My basal metabolic rate went up to almost 1,600 calories. So it's just the pure muscle I built, burning more to survive, which gives you more ability to eat more, frankly. Isn't that amazing how much, muscle really burns a lot of calories to survive?
Yeah, muscle, the more you have, it's the longer you live. There's a increase in all-cause mortality in sarcopenia, in low muscle mass.
Yeah.
We don't say that from obesity or high body fat or high visceral fat. We don't say your risk for all-cause mortality increases.
Yeah.
No. But with low muscle mass, it does.
You talk about so much in Weightless and about how regulating appetite cannot be willpower, but we also live in an environment where our food systems, the marketing, the cultural norms, without even noticing it, it shapes how we consume. How does that play into all of this? And frankly, you live in New York where there's a bodega with fresh food everywhere, but in middle America, there are real food deserts. How do people manage?
And the food industry definitely has not our health into their priority, right? It's a more of a economic transaction. It's not our health. And I can see even when patients start on a GLP-1, before there's significant weight loss to say we can attribute feeling better to that, patients feel immediately better, lighter, less swollen, less inflamed within the first week, within the first few days.
Amazing.
What's happening? It's amazing. And what's happening in the first few days? It's not the weight loss, it's that they're cutting by half what they're eating. That's just to show us the poor quality of the food that we consume, that just by decreasing by half, you feel less bloated, less inflamed, you feel lighter, you feel it in your joints, you feel it in your skin, before we can attribute it to fat loss, right? So the quality of our food is very, very poor. And also I see many patients that didn't grow up in the United States and they didn't struggle with weight, but once they move here, is their 30, 40, 50 pounds, right? And then they have children here, and then that's past transgenerational. And then that's what we are right now with this epidemic of obesity. So definitely our food is setting at us for failure. We can be smart consumers to certain points, right? With the things that we teach them, like what I just mentioned, grass-fed food, wild-caught fish, pasture-raised chicken, pasture-raised eggs. But that's only possible so much for so many people, right? But even just the medication is teaching us, just by eating half of what we normally eat, you're going to feel better.
Well, and you know what? I had a friend once, before GLP-1s became popular, but that's how he lost a lot of weight, is recognizing that the portions in this country are astronomical. You and I travel abroad a lot, but for people who don't have the opportunity to do that, if you go to Europe and they serve you a dish of pasta, it's the size of your fist. In the United States, it's this big. You take it home for 3 days. And so, even that kind of regulation can go a long way.
I think the GLP-1s will change the food industry. I think they're changing it already, because somebody who's on a GLP-1 and goes to a restaurant, you order an appetizer and you get full with that, right?
Yeah.
So I think they're going to have to adjust of what the consumer is going to be needing as more and more people are on a GLP-1, right?
So what do you think it is? Do you think the road to better body composition is GPS first? Do you think it's mindset first? Do you think it's finding someone great like you? I mean, if you have to prioritize, where do people start? Where do people start? I fed you that, didn't I? You start with Weightless.
Reading my book.
Right. December 30th, people.
December 30th, you can start reading my book. No, I'm going to tell you why. Because in it, and I was very careful of how I wrote it and what the message that I wanted to. Every word here, believe me, it's meant to be there. Everything that I wrote, it's meant to be there. It has a purpose. It has a reasoning on it. Because I teach you and I tell you why is it that you're struggling, right? So the answer is going to depend for what's the reason that brought them to have a consultation with me or to think of a GLP-1 or to use a GLP-1, right? So for people that have struggled with their weight most of their life, yes, a GLP-1 will really help them. So they should start there. Yeah. They don't have to prove themselves to us anymore. They don't have to convince me.
You believe
anymore.
them.
I know what they did or they've done to get to a point without the results, right? Yeah. So it's a GLP-1 should not be the last resource for anybody. Number one, yeah. Right? So if you feel that it's out of your hands and it feels like a full-time job, you should start with a GLP-1. If you're somewhere in between, lifting weights is always the best answer, nice. Right? So if you start a GLP-1, you should always start a GLP-1 with weight training. So the best thing that anybody can make for their health is to lift weights. And this sounds like we're really like broken record, but there's no surprises with muscle gain. There's no,
it's predictable. It's predictable if you just do the
100% predictable. If you just do it, it's going to give you back the effort that you're putting on it, right? But what I'm seeing now with GLP-1, we are reaching metabolic health that wasn't possible before, right? So I'm really excited to see, and I see it in my patients, what people are going to be able to do with their body.
Yeah.
Right? Because for the first time, many of them, they gave up on their body, on what they can do with it, just like the basics, go up, not even go up the stairs for somebody. But once they start seeing, oh, I can lift this. Oh, I can move this way. It becomes part of them, and they want more, and they want to see what else can my body do for me. And there's no age for that. I have patients in their 70s that they start lifting weights. I had a patient in their 70s that never lifted weights. After several visits, she started lifting weights. She came back to me one day and she said, "Doctor, I was going to slip. I held myself with my core. I felt it."
That's amazing. She saved her life. She could have broken her hip. Yep.
She could have broken her hip. And she said, "I felt my core held me." That is like no price on it, right? I mean,
right. It's amazing. Well, you know, because I have the privilege of listening to you often and discussing this book, it occurs to me, tell me if I'm right, that Weightless not only begins by a deep empathy based on your clinical practice of understanding where people are coming to you from. You just said it. I understand. You don't have to convince me. And then you've harnessed all your years. I mean, you're triple board certified, for God's sake. Rocío, how about being overqualified? You've harnessed all of your medical knowledge into a real how-to book, how to evaluate, how to prescribe, what is GPS. But what I hear you saying, and tell me if I'm interpreting this right, at the end of the book, you're giving people hope for a different way of living.
Yeah, I'm showing them what they can do, what their body can do, where they can take them, and that being old and unhealthy they don't go together. It's a mindset too, right? What you tell your body is what's going to happen. So what I want to show you is that you can be 60, you can be 70, and you can feel strong. And the earlier you start, the better. But even if you're late started, there's no, what do people tell me, when is it late too late. It's never too late to lift weights. It's never too late to get optimal health. And I have women that can come and tell me, well, I know I'm never going to feel 100% again, but, and I stop them and I said, never accept anything below 100% of feeling or how you should feel, because you may have 40 more years of life. How are you going to live 70% of that?
Yeah.
Don't accept less than 100%, because it can happen. It is possible.
Dr. Rocío Salas-Whalen, author of Weightless, out December 30th. So go get it now on pre-order. Thank you so much for your time today. I know you're rushing back to the patients we're talking about today. Thank you so much.
Waiting for me.
Yeah. Thanks for being here.
Thanks for joining us on Hot for Your Health, where we bring you conversations from the bleeding edge of science, health, and culture. You can find links from today's show and connect with me at drvondawright.com. Don't forget to subscribe and leave a review wherever you listen to podcasts. I'm Dr. Vonda Wright. See you next week.